Thank you, Mr. Chairman. Thank you to our witnesses. I think the topic of our hearing today is very timely. I think that as we sort through these issues, this is a tremendous opportunity to work together, realizing that we have a challenge ahead of us where we have the success in many respects of Medicare Part D and the dynamics and the overall framework of Medicare Part D has proven very successful. The question is, how can we take those dynamics and make sure that there is ample competition and choice and access for seniors, and actually not just seniors, but everyone, all demographics. And I know that this issue is really so important to folks of all ages. I mean, the rising out-of-pocket healthcare costs in general are impacting more and more Americans, illustrating, hearing from my constituents that tell me that $30,000 a year out-of-pocket expense for their health insurance, they would not consider to be affordable. And I hope we listen to them. And instead of, when we look at bigger premiums, higher deductibles, and fewer plan options, patients are faced with higher and higher costs for these essential medicines, such as the insulin mentioned by Mr. Ruther. In order to bring down these costs in the long term, we need to address the problems with incentives built into our healthcare system which benefit those bad actors and hurt the long-term competition. It's necessary for both sides to come together to find consensus solutions, as I mentioned earlier, which adjust these incentives to bring new solutions to the market faster and increase healthy competition. As Mr. Ruther expressed, the long-term solution for the present high cost of insulin is to foster greater competition among the manufacturers of insulin. In contrast, Medicare for All plans would increase, not decrease, government manipulation and spending on the healthcare system, while failing to address these underlying factors. Now, take, for example, Medicare Part D. As I mentioned earlier, a widely popular program which has performed actually better than its originally projected costs, because the private insurers compete against one another to offer a variety of competitive plans. Increasing government involvement in the program by repealing Medicare Part D non-interference would simply be an exercise in price setting rather than negotiation. In fact, the CBO has said in the past that allowing the health secretary to supposedly negotiate drug prices in Medicare would only save money to the extent that the Medicare program is willing to limit seniors' access to certain drugs. We've touched a little bit on that here this morning. Mr. Antos, can you further elaborate and explain why the CBO would have come to this conclusion and what the broader effects a repeal of non-interference would have on the pharmaceutical market and consumer access?
Yeah, yes. I think it's a fundamental view of virtually every economist that unless you're willing to walk away from a product, you're not going to be able to get a much better price. Medicare is not in that position. Every president that I know of since 1965 has said we're not going to touch Medicare. And the obvious fact is that it's very, very difficult to say no, especially in this kind of situation where we may be talking about a very expensive drug that could be potentially life-saving for some senior citizens. So being able to walk away is just not in the cards. The other problem, though, is how do you know you've actually gotten a good price, and will it really last? So you may actually negotiate a price that looks pretty good one year, but that doesn't necessarily mean that you're going to be able to keep that price. After all, when you negotiate a price, oftentimes that's the floor price. That's the ceiling price. Sorry, that's the floor price, not the ceiling price. Prices go up from what you negotiated. And so that eliminates an important element of competition. If you have competition, there might be another product that might actually drive the price down of that original product, but you won't see it if you've negotiated what is essentially a floor price.
Okay, very good. Thank you very much. I just hope that we as a committee will keep in mind, number one, consumer choices for seniors, especially with Medicare Part D, but Medicare Advantage. I mean, there are more and more seniors who are very pleased with what they have access to with Medicare Advantage and certainly Medicare Part D, and the numbers are indisputable in terms of actually helping keep some of those costs down for Medicare Part D. We need to look at how we can make sure that other costs are facing more competition and more consumer choice. Thank you. I yield back.